So buccal fat pad reduction is becoming a very popular procedure that patients are coming in asking about. Probably a few years ago, patients really didn't even know that the procedure existed, but I think because of a lot of online and social media things, people are becoming more aware of it. And what we're finding is patients, particularly younger patients, that are coming in with a full face, maybe a poorly defined jawline, poorly defined cheekbones, are coming in and looking for options to contour their face in a minimally invasive fashion. And the options, which used to be augmentation of the cheekbones and maybe some submental liposuction, which are still great options for patients that are candidates for this, um, you know, didn't really include addressing the buccal fat. And there's also this misconception that buccal fat pad reduction, um, if you gain or lose weight, could be influenced. So that the studies that have been out and published have shown that regardless of weight fluctuation, the mass of the buccal fat pad actually remains about the same. And so it's not a weight dependent fat pad in the face. So what we're finding is in order to help to contour the lower face, buccal fat pads should be considered in the appropriate candidate. And the appropriate candidate is going to be a patient that has sort of a square and boxy face with a poorly defined jawline and poorly defined cheekbones. And removal of the buccal fat can help to give a little bit more contour, especially highlighting the cheekbone and the mandible. Because most of the patients that are coming in seeking this procedure are younger, the most common method to remove or reduce the buccal fat pad is going to be the intraoral approach. In certain patients that are of the older population that are getting facelift simultaneously, and this is not very common in my practice at least, some of those patients will also have prominence of the buccal fat pad, and during a facelift, the buccal fat can be addressed from the deep plane approach. But by and large, the most common modality for reducing buccal fat pads is the intraoral approach. And what's great about it is it could be done in the office under local anesthesia. Patients are very comfortable with it. It's very similar to going to the dentist and having a filling or having some minor dental procedures done. And the procedure itself does not take very long.